Disorders of the gastrointestinal tract. Gastro-Oesophageal reflux disease is caused by backflow of gastric or duodenal contents past the lower esophageal sphincter into the esophagus without belching or vomiting. The disease is classified into two groups based on endoscopy findings as non-erosive or erosive gastroesophageal disease. So failure to treat may result in esophagitis, ulceration, strictures, and rarely adenocarcinomas. Causes include obesity, hiatus hernia, increased intra-abdominal pressure, for example in pregnancy, and long-term use of nasogastric tube, and agents that decrease lower esophageal sphincter pressures, for example alcohol, cigarettes, anticholinergics, hyoscine butyl bromide, propanthyl bromide, and other drugs like morphine, diazepam, pethidine, and calcium channel blockers. Children with chronic neurological disease, for example cerebral palsy, could have gastro-esophageal reflux disease. Okay, so the symptoms include heartburns, which worsens with vigorous exercise, bending forward and lying, is relieved by antacids and sitting upright. Dyspepsia, early satiety, and then retrosternal pain and epigastric pain, which mimics angina pectoris by radiating to the neck, jaws, and arms, and the pain is worse on bending down, for example sweeping. There is also pain on swallowing and difficulty swallowing, and nocturnal regurgitations may be present. The patient wakes up with coughing, choking, and filling of the mouth with saliva, and asthma-like symptoms may occur, which may be worse at night. In children, there is failure to thrive or refusing to eat, vomiting, coughing, wheezing, iron deficiency anemia. There's also forceful regurgitation, which may lead to aspiration pneumonia. Okay, for the signs, there may be none, but chest signs could be elicited, for example wheezing and epigastric tenderness occasionally. Investigations include esophageal gastroduodenoscopy as upper gastrointestinal tract endoscopy, chest x-ray to exclude other causes, abdominal ultrasound to exclude other diseases, and barium swallow with fluoroscopy, especially useful in children, and esophageal pH monitoring in cases that are too difficult to diagnose, and lower esophageal sphincter manometry. That's also in cases that are too difficult to diagnose. So for the treatment, the main treatment objectives are to relieve the symptoms and to prevent complications. Non-pharmacological treatments include lifestyle changes. Okay, so elevate head of bed about 30 degrees or sleep on pillows, and avoid sleeping within 3 hours after eating. Avoid overeating and heavy meals before bedtime, and avoid foods that aggravate symptoms, for example fatty and spicy foods, and avoid smoking and alcohol, and avoid non-steroidal anti-inflammatory drugs. Encourage moderate exercise, weight reduction in overweight and obese individuals, and avoid corsets, as instead wear loose clothing. Surgical treatment, fundoplication for severe cases, treatment failures and complications. Okay, so for pharmacological treatment in non-erosive gastroesophageal reflux disease, You give magnesium triacylate oral 15 milliliters 8 hourly in between meals and at bedtime to control dyspepsia. Or you can give antacids containing aluminum hydroxide, magnesium hydroxide, and simeticone or calcium alginates. Or you could give omeprazole oral 20 milligrams daily for 4 to 8 weeks. That's in adults. For children with weight greater than 20 kilograms, you give 20 milligram of omeprazole daily for 4 to 8 weeks. For weight 10 to 20 kilograms, give 10 milligrams daily for 4 to 8 weeks, and 5 to 10 kilograms, give 5 milligrams daily for 4 to 8 weeks. Or you could also give esomeprazole oral in adults 40 milligrams daily for 4 to 8 weeks, or rabeprazole oral for adults 20 milligrams daily for 4 to 8 weeks. For severe or erosive gastroesophageal reflux disease, you give omeprazole oral in adults for 20 to 40 milligrams daily for 8 weeks. And for children with weights more than 20 kilograms, give 20 milligrams daily for 4 to 8 weeks. And 10 to 20 kilograms, give 10 milligrams daily for 4 to 8 weeks. And 5 to 10 kilograms, give 5 milligrams daily for 4 to 8 weeks. Or you could also give esomeprazole oral in adults 40 milligrams daily for 8 weeks. Or you can also give rabeprazole oral in adults 20 to 40 milligrams daily for 8 weeks. Okay, but for severe or erosive gastroesophageal reflux disease with bloating, you could use the medications I just mentioned, omeprazole or esomeprazole or rabeprazole, and add metoclopramide oral in adults 10 to 20 milligrams 6 to 8 hourly. Or you could give domperidone oral in adults 10 milligrams 6 to 8 hourly.